Welcome to the UCD School of Medicine Psychotherapy webinar, which is part of UCD's Masters Week. This session is tailored to give you an insight into the psychotherapy graduate thought course offering in UCD School of Medicine. UCD has an international reputation as a centre of excellence in the domain of psychotherapy, and the school offers an extensive portfolio of graduate opportunities in 4 of the main recognised branches of psychotherapy. All lecturers on the course are clinicians with considerable academic expertise in their own modality of psychotherapy. But before we get started, there are a couple of things that I just want to tell you so we can get the most out of this webinar. We are happy to answer questions as we go along, but feel free to post them into the questions and answers section at the bottom of the screen. There will also be some time for questions and answers session at the end. And if you think of any questions afterwards, you can email us at anya.bergen@ucd.ie. That email address I will pop into the chat function later. In case of any latecomers, for those of you who have just joined us, welcome to UCD School of Medicine Psychotherapy webinar, which is part of UCD Masters Week. So without further delay, I will hand you over to our first speaker, Dr. Barry O'Donnell, who is the Director of Psychotherapy Programmes in UCD.
I'm delighted to be speaking to you this afternoon and the honour of giving you a brief introduction, an overall introduction to the psychotherapy programmes in the School of Medicine in UCD, and then to introduce my colleagues who will speak to you about the specific professional master's programmes in specific modalities of psychotherapy training. So after my brief overview, we'll be inviting Aisling Kenny and Katja Hare to take us through the Child Art Psychotherapy training programme. Then Valerie Preston will take us through the group analytic psychotherapy programmes. Dr. Grania Donoghue will take us through the psychoanalytic psychotherapy programmes. And then Professor Valerie O'Brien will take us through the systemic psychotherapy individual, couple and families programme. So next. So just to name the programs specifically, we're focusing on the 4 programs that are at the bottom of this slide: the professional master's programs in psychoanalytic psychotherapy, group analytic psychotherapy, child art psychotherapy, and systemic psychotherapy. And each of my colleagues will take you through the structure of those programs. Just a mention of a higher diploma in psychotherapy studies that we mentioned in passing, which is an entry point into the field of psychotherapy. It's a 2-trimester or 3-trimester program that is extremely effective in giving people a very solid grounding and foundation in in a knowledge of the different forms of psychotherapy if you're unsure of what the different modalities are about. And then also the graduate diploma in psychoanalytic studies, a specifically psychoanalytic starter into the field of psychoanalysis. So next, Giselle, thank you. So just to point out that the UCD psychotherapy programs are based on programs that go back over 50 years, based in St. Vincent's University Hospital and the Mater University Hospital and on the Belfield campus. So say we've been around a while. Next slide, thank you. So the couple of questions that I suppose I'd offer to you to maybe formulate perhaps the question that has you attend this seminar, this webinar this afternoon. There's something about the word psychotherapy or the word psychoanalysis that has come to occupy you. The question is, how has that happened? Why has that happened? We would very much respect this question, value this question, and encourage you to work on this question, perhaps by getting in contact with us to see where this might lead you. So we very much encourage having the question. And the other questions, variations of that: what form of work do you find yourself drawn to? Hopefully the slides in the presentation will help you inform that, an answer to that, or beginning of an answer to that. Why the particular modality, and the few basic things about the psychotherapy programs that are across the different modalities. A practitioner of psychotherapy or psychoanalysis bases their practice on a very extensive experience of their own psychotherapy or psychoanalysis, their own engagement in psychotherapy exercises. Psychotherapy, psychoanalysis puts a person to work So maybe unlike other forms of healthcare and social care, the person attending has to engage in the work. So the task for the practitioner is to bring the person into the work. So the question is, how do I go about doing that? They are practices of listening and responding. And one of the things we emphasize is that they are very different in the ways they listen and what they're listening for. And hopefully some of that will come across over the afternoon. Next. So just in terms of, I suppose, there's a dominant paradigm of the mental out there, and I suppose we might challenge that to some extent. At one level, the notion that our mental lives are reasonable and they engage with common sense, what I call the Daily Mail approach, that people just need to cop onto themselves and get over themselves, etc., as if it were so easy. And each of us can ask, is this my own experience of my mental life? And I think if you're here this afternoon, the answer should be it isn't. It's much more interesting than that, and much more challenging, and requires work to see how can I manage it. Also, that question of the difference between the normal and the pathological. These days, with all these terms flying around in terms of diagnoses used in everyday conversation, perhaps questionably, but then also used in clinical diagnostic practice, and the question of whether how we are as human beings, in terms of our pathologies, whether they differ in kind or they differ in degree. So I suppose there is a challenge. There's every respect for a neurophysiological, neuroscientific approach to the field of the mental. That's very valid, and we take that with great respect. But alongside of that, just the practice of listening, trying to work something out, whatever the neurophysiology might be. So as I say, I'd offer the picture of Velasquez's Las Meninas as maybe capturing something more closer to the complexity of mental life rather than the more diagrammatic image at the top there. So next. Again, in terms of human beings or human nature, a wonderful quote that I think captures so much. In many classrooms around the world, it is Shakespeare who breaks the bad news. Humans are weak, immoral, lustful, deceitful, murderous, jealous, decrepit and insane, and their pursuit of love, power and death and disaster are all too common. That's a rather dark account of us, but I think nightly on the news we see that it is probably true. Next slide. Because thankfully there's another side to us. We are able to laugh. We are able to enjoy. This is a rather long quote, but it's from an Irish neurologist who works in London, well-known writer Suzanne O'Sullivan. And she's just pointing out, even from a neurological point of view, that it is a joke, a witticism, a play on words that has us bend over backwards and frontwards and that laughing our heads off. So just that message that words, thoughts can make me laugh and cry and they can make me ill. So that's just some thoughts for you in terms of the domain we're working in, the domain of language and speaking and working things out. Next slide, Giselle. Thank you. So the UCD professional master's programs are designed to fulfill current psychotherapy professional body requirements, particularly those of the ICP, to allow graduates to apply for membership to the respective body within the ICP. The programs are also continuing to work to satisfy anticipated state regulation requirements from CORU, which have not come in yet, but are expected in the coming years. Next slide. So final question from my point of view, what form of study, what form of work in the fields of psychotherapy or psychoanalysis am I drawn to put myself into? And we invite you after this afternoon to contact us at anya.bergen@ucd.ie to take that question further. So now, next slide, I'm delighted to be introducing and passing on the slides to my colleagues Aisling Kenny and Katja Hare to speak to you about child art psychotherapy. Thank you very much.
So good afternoon, everyone, and thank you, Barry, for that wonderful introduction. My name is Aisling Kenny, just to say again, and I'm one of the assistant professors here on the Child Art Psychotherapy programs. Myself and my colleague, Ms. Katja Hare, assistant professor, are both delighted to guide you through this information session today on the programs that we offer in Child Art Psychotherapy. Next slide, please. So first off, I'd like to briefly explain what Child Art Psychotherapy is. It's a method of psychotherapy specifically for children and adolescents who struggle to express themselves verbally. This method was developed and pioneered by Vera Vasarely in the late 80s and early 90s in the UK in the context of her work on a multidisciplinary team in a child and adolescent mental health setting. Vasarely was invited to introduce this training into Dublin by psychiatrists from the Mater University Hospital in 2001. And the training has been running ever since and evolving, and we are now entering into our 24th year. Moving on to the next slide, please. Thank you. Moving on to the specific approach of this psychotherapy, it's important to note that it is an integrative psychotherapy, which means it draws from psychoanalytic, humanistic, psychodynamic, and Jungian traditions. The focus in child art psychotherapy is on the image, which is created in the context of a contained, safe therapeutic relationship. Young people are then supported to explore using these images, their external and internal struggles, as well as processing past experiences and current difficulties on both a conscious and unconscious level. The child can engage with child art psychotherapy on a conscious level. And what do I mean by that? Whereby their thoughts and feelings that they are aware of can be expressed directly onto the image. Working with the unconscious, however, we are actively looking out for thoughts, feelings, perceptions, desires, shameful or traumatic experiences that the child may not be aware of that are affecting their behaviour, and how these unconscious manifestations emerge on images. So in child art psychotherapy, this can facilitate access to this unconscious material in a safe way to bring it into conscious awareness, to be processed and integrated. So really, what are we saying about child art psychotherapy? In essence, the exploration in child art psychotherapy is through the image. So next slide, and I'll hand you over to Katia.
Thank you, Aisling. So I'm just going to talk you through the 4 years master's program in child art psychotherapy, which is a professional master's, and that's X997. So the first 2 years of that program, it's up there. So in the first 2 years of the program, I suppose the program is very much based on people gaining a clinical experience. So in the first 2 years of the program, students would have a placement in a child and adolescent mental health service. The program focuses on teaching very much the Vasarely method of child art psychotherapy, but also taught on the program is child mental health, which would be taught by psychiatrists. There is input around developmental psychology and the fundamental theories of psychotherapeutic work are also taught. Then in years 3 and 4 of the program, students are on a second placement, usually in TUSLA or within another suitable organization. And the training will focus on deepening, psychotherapeutic practice through more seminars and workshops. I suppose something to mention about all of the psychotherapy programs is that very much the training focuses on personal development. So there would be personal development both through weekly personal therapy, which takes place, students are required to attend outside of course, but also there is group process which happens while students are attending the course. I'll pass you on. So I suppose just to say as well that for some people, the 4-year training, or maybe, the training towards becoming a fully accredited child art psychotherapist is not suitable, or there is a 2-year exit strategy, and that is the program X987. And I'll pass you back to Aisling there.
Okay, thanks, Katia. So as you can see from this slide here, this is an overview of the modules involved from years 1 to 4. So I'm just going to take you through those modules, not in great detail, but just to give you a sense and a flavour of what topics will be covered. So as you can see, in year 1 and 2, lectures are 1 day a week in UCD, and then there's clinical placement for another 1 day per week. So that's 2 days. To start off with the Vasarely method. So this is an extensive method-specific teaching and training in child art psychotherapy, which involves experiential on a group basis and also on an individual basis. And also it involves case presentations. The psychotherapeutic modality, this is seminars and lectures from senior clinicians in the areas of psychoanalytic, psychodynamic, humanistic, and Jungian perspectives. The child and adolescent mental health, these lectures are led by child psychiatry, UCD School of Medicine, in areas such as anxiety disorders, mood disorders, eating disorders, and neurodevelopmental. And there's a research component, and I suppose there's a series of lectures on research skills, and this culminates in the production of a research protocol at year 2. And then pictorial thinking, and this is a series of lectures on the history and development of art psychotherapy. And also as part, as Katia mentioned already, as part of years 1 and 2, supervision is weekly, group process is weekly, and there's also a minor dissertation at the end of year 2. So then kind of moving along quickly to years 3 and 4. So first off, to note that clinical placement increases to 2 days per week, and that's usually in TUSLA. And lectures are reduced, they go down to 1 day a month. So your child and art psychotherapy seminars continue. Discourses in child and adolescent psychopathology, that's slightly different, and I suppose these are seminars that specialists guest speakers from specific fields are invited to lecture on specialist topics such as trauma, gender identity, self-care, neuroscience, ethical issues, and child sexual abuse. So next slide, please. So here we have beautiful images of a very recent experiential session with our second years. As you can see, they're all involved. This was a group exercise. And I think it's really important to note that it's not a prerequisite to be good at art. Actually, it's really experiential, so you do not have to be good at art to do this training. So that's just to give you a sense. So next slide, please. And I think I'll hand you back over to Katia.
Yeah, so I suppose I'm just going to quickly run through these. It's just I'm supposed to note that there are a number of assignments and assessments throughout the programme. They vary from written examination to oral presentations. The 2 main ones, I suppose, are the minor dissertation at the end of year 2, and then the clinical paper at the end of year 4. Next slide, please. And this is just a breakdown of the psychotherapy and supervision requirements. So the group process and supervision hours, all of those hours are provided by the training, and they are in line with what the accrediting bodies require. And it's really the personal psychotherapy hours, which are approximately 200, I suppose, over the 4 years, which is a requirement that students have to fulfill outside of the programme. So that's an important one to note. And next slide, please. We're finished. Thank you very much.
Good afternoon, everybody, and welcome to hearing something about the group analytic training. My name is Valerie Preston, and I am one of the trainers on the course. Now I'm going to talk to notes I have here, and maybe the slides won't totally coordinate, but let's go to the next slide, and I might pass it on when I see it. You can read it, and I'll begin telling you something about what group analysis is. It's group analytic psychotherapy, also known as group analysis. It's a method of group psychotherapy, and it was originated by S.H. Fuchs in the 1940s. Fuchs was a German psychiatrist and psychoanalyst, but he moved to England and then to escape Nazi Germany. And he was an officer in the army, and he worked with shell-shocked soldiers in a place called Northfield Military Hospital in the UK. And this is where he developed his method of group analysis. So treating the wounded to get them back to battle in a group. So group analysis focuses on the relationship between the individual and the group, emphasizing the social nature of the human experience. As a therapeutic tool, group analysis aims to strengthen the relationship between the individual and the group to achieve a healthier integration of the individual in their communal network. The ethos of group analysis, as proposed by Fuchs, gives weight and value to the experiential nature of learning in a group. The group analytic training privileges group participation for all group members, including the conductor, as the method of learning. So currently there's 30 odd students on the training as a whole at different levels, and there are 10 group analysts who are the trainers, conductors, and that cohort works together in developing and learning. We can go on to the next slide and possibly swap over that one, go to the next one. Yeah, we can stay on that one. So the course structure and exit and entries, exit strategies. The emphasis of the course is on the clinical training. And the course that means working towards qualifying as a group analytic psychotherapist and being awarded the clinical license to practice, which and register with the professional bodies of the Irish Group Analytic Society and the Irish Council for Psychotherapy. It's a part-time clinical training run in block weekends, so from a Friday to a Sunday for 9 weekends of the academic year from September until June. And the entry point is actually the graduate certificate in group analytic studies. So that is the first year. So no matter if you've got a PhD or lots of degrees, you still have to join the training on the graduate certificate level. So it will be, and it's a 1-year course, and it's at level 9 with 30 credits. I'll tell you about the structure of the weekends, and it's the same with different emphasis on the depth of learning as you progress. So over a weekend, you'll have experiential learning and be in a therapy group for 1.5 hour sessions, and 5 of those, and it'd be in a large group with all the students on the training twice in the weekend for 2 hours. And there'll be supervision groups and theory seminars, lectures, and reflective learning. And the course attracts health-based professionals like psychologists, occupational therapists, GPs, psychiatrists, but also educators, team leaders, organizational consultants, work group practitioners, and anyone interested in groups or group work. The Professional Masters in Group Analytic Psychotherapy is a 5-year course, and with an exit option at 2 years. And I'll tell you about that after I've talked about the Professional Masters. And this is at level 9 with 180 credits, and that includes the graduate certificate in group analytic studies. So the Professional Masters in Group Analytic Psychotherapy aims to train practitioners in the model of group analysis and its application in clinical and non-clinical settings, such as organizations and work groups. Through participation in group seminars and the group supervision, large group and therapy sessions, trainees experience group analysis in practice and theory. Alongside this learning in year 1 and 2, the student sets up a short-term group, like for 12 weeks, and like a support group, and are working under supervision in their learning. And for the years 3, 4, and 5, they set up an analytic long-term group, which has to run for 2 years. So are on the training, working under supervision, and working through the experience and of themselves in that context, and becoming the conductor, along with learning other theory, writing their essays and all the components of the course. On being awarded the Professional Masters in Psychotherapy, the trainee joins the program of learning. So this is once the course is finished and they've reached all the requirements of the training, the Masters. And on the program of learning in the School of Psychotherapy, they complete a clinical paper which explores the experience of setting up the group and looking at emerging themes. And once that's completed, they are eligible for the clinical license to practice. And then briefly, and lastly, the Masters in Group Analytic Studies, which is the exit at 2 years into the Master's program. If someone doesn't want to continue with the full training, they can exit here, having completed their setup of the 12-week group and fulfilling all the requirements of the training. all the group members are together on the training. So whatever level, first, second, third years, and the graduate certificates. Thank you very much.
Thank you very much, Valerie. So good afternoon to everybody else. My name is Gráinne Donoghue. I work as a lecturer and module leader alongside Dr. Barry O'Donnell, who you met already, and I'm going to introduce you to our professional psychoanalytic psychotherapy master's programme. Firstly, to give you a sense of its history, as Barry alluded to there earlier, the origins of this programme began 40 years ago, and we just celebrated our anniversary recently in St. Vincent's University Hospital. So it began 40 years ago in 1984. Under UCD academic governance, but since then the psychoanalytic teaching, practice and experience of this programme has significantly contributed to the formation in clinical practice for many psychoanalytic practitioners across Ireland and other clinicians who benefit from psychoanalytic based their work. The professional Masters in Psychoanalytic Psychotherapy, it's a part-time 4-year programme providing professional clinical training in psychoanalytic psychotherapy, founded, and this is the essential take home for today, on a student's engagement in their own personal psychoanalysis. So also important to say at the outset, although there are other psychoanalytic theorists and ideas, this programme's module content develops an understanding of the principles underlying the clinical practice of psychoanalytic psychotherapy, a discipline launched by the pioneering work of Sigmund Freud, but is also strongly informed by the work of French psychoanalyst and psychiatrist Jacques Lacan, whose seminars and writings elaborated on Freud's work. So the programme is relevant for any mental health professional, including GPs, psychiatrists, psychologists, social workers, social care workers, therapists, and so on. But we also accept applications from candidates from other backgrounds who are suitable for the programme based on prior experience of their own psychoanalysis. Next slide, please, Giselle. So the Psychoanalytic Psychotherapy Master's Programme has 3 key components. Firstly, we have personal psychoanalysis. So as I alluded to there, for our psychoanalytic programs, the following basic principle applies: that fundamental to undertaking a psychoanalytic study and training is the requirement that each student engage in their own personal psychoanalysis. So when in psychoanalysis, you should expect to be attending at least twice a week. Already having started one's own psychoanalysis, having an arrangement in place would contribute very strongly to an application, particularly when you do not have previous clinical experience or working in a kind of social or healthcare setting. The second component is the theoretical study or research. So as I said, the content of this programme is the work of Sigmund Freud and Jacques Lacan. So students on the programme need to be able to commit to engagement with this body of work and indeed have some previous interest or encounter with it, which would strengthen your application to this programme. Thirdly is our supervised clinical practice, and this begins from semester 1, year 1, where students are expected to put in place an arrangement where they can listen to people in a clinical setting from a psychoanalytic perspective and respond in accordance with psychoanalytic principles. Next slide, please, Giselle. So in terms of the practicalities of the programme, this is, as I said, a 4-year part-time programme, which is intake on an annual basis, commencing early September for trimester 1 and continuing till early May. For the first 2 years of the programme, attendance is on Wednesday afternoon to evening, 2 to 7:45 p.m, and Thursday morning, 9 a.m. to 1 p.m. from early September to May, as I said. The weekly contact hours are divided between formal teaching, including seminars, and small group supervision, which is about an hour and a half. The programme includes both a research dissertation and a clinical paper testifying to practicing psychoanalytically. Years 3 and 4 concentrate more on the clinical components of the programme, with practice and supervision occurring alongside a number of weekend workshops on continuing development within the psychoanalytic field. Students are expected to have, at a minimum, the equivalent of at least 1 further day available for work related to the programme. And this is a question that comes up quite a lot when you see a part-time programme and you think it might only be a day or a day and a half, but you want to account for at least another day for your personal psychoanalysis. As I said, a minimum of 2 sessions a week, clinical practice with a minimum of 2 clients a week, and attending weekly individual supervision and preparing and researching your coursework. So all of our teaching is carried out in person in the School of Psychotherapy, which is based in St. Vincent's University Hospital in Nellen Park. The programme is recognised by the Association for Psychoanalysis and Psychotherapy in Ireland, that's APPI, which is a member of the Psychoanalytic section of the Irish Council for Psychotherapy. And this provides a 4-year specific modality training in psychoanalytic psychotherapy, which can fulfill ICP, psychoanalytic professional body requirements for application for membership. So we are currently accepting applications for a start in September 2025, but we will review these in March and contact suitable applicants for interviews at that stage. So next slide, please. So this is just, I'll just quickly mention, I know Barry alluded to it already, but just another option to consider. So if you are an applicant and you're not looking for psychotherapy professional body recognition, there is a 2-year exit award for our professional masters called the MSc in Psychoanalytic Psychotherapy Studies. This program consists of the clinical and theoretical modules from the first 2 years of the 4-year professional masters. But as with all of the programs involving engagement with the psychoanalytic field, it's also required that you would be engaged in your own personal psychoanalysis. Also for your consideration is where an applicant chooses not to take up the clinical component at this point in time, but is interested in the engagement in their own psychoanalysis, and the formal structured psychoanalytic study is a 2-year graduate diploma in psychoanalytic studies. This program consists of the theoretical modules of the first 2 years of the professional master. So in practice, that would be you would join the master's group on the Wednesday, and you wouldn't be there for the Thursday, which is more clinically based. So again, you would attend your own personal psychoanalysis for that. And then finally, if all of these ideas or modalities of psychotherapy are slightly confusing, our higher diploma, it's not psychoanalytically based. It's open to all the different modalities, and it provides you with a solid foundation in understanding the differences between all of these major modalities, so that you have an informed choice about entering into a clinical training. So emphasizing, however, that the higher diploma is not a clinical training, it does provide a basis upon which to make an informed choice. So like all our programs, the higher diploma is taught by teacher or practitioners from different modalities of not just psychotherapy, but also psychiatry, psychology, and psychoanalysis. We welcome any questions on the psychoanalytic programs in the chat function, and if we can't answer today, you can contact us either on the email provided by Jean at the start, Anya Bergen, or myself, Gráinne Donoghue. So I will now hand you over to Professor Valerie O'Brien, who is going to introduce you to the Professional Masters in Systemic Psychotherapy programs at UCD. Thank you.
Thank you very much, Gráinne. So the difference between systemic psychotherapy and psychoanalytical is that there is a greater focus on the interrelationship of people in the systems that they occupy. But there is a huge similarity in terms of our psychotherapy also places a lot of focus on language. So the difference is we place greater emphasis on relationships, and I think ethics is core to all psychotherapy practice. I think interesting, systemic psychotherapy is also known as family therapy. And I think that's a really important distinction. Because for many people, they may have heard of family therapists. So what draws people into a systemic program is not just an interest in terms of the individual in the context of their relationship, but it's also a program that's designed to enable people, once they qualify, to work with individuals, couples, family groups, and organizations. Next, please. So for a systemic approach, we as humans, we live in complex and multiple relational systems. So to that end, the training is geared towards training people to work with complex multiple relationship systems in which individuals, couples, families, work teams are embedded. Next, please. So we use the metaphor of system to understand family functioning and family members. And unfortunately, I don't have a lot of time to go into the core concepts here, but I think we're all very familiar with the notion of being part of systems and all that involves: family systems, couple systems, work systems, and part of wider societal systems. Next, please. So our teaching, the core words here are the focus on experiential learning, on developing a sense of self, and also in terms of that when we learn in the context of communities of practice. We also very, very much work alongside clients, and there's an emphasis on co-creation and understanding, and the co-creation in terms of solutions. Next, please. So there's 4 elements to our training. There's, again, similarities: theory and methodology, clinical practice. So we call ourselves development, we call it personal and professional development and integration. Unlike our colleagues in psychoanalytical, we do not require our individual students to be in individual therapy. Instead, we do a group process as part and parcel of the training, and that's called personal and professional development integration. If people choose, of course, to pursue some of these issues within their own individual practice, that is absolutely fine and encouraged, but it is not a requirement. And then the fourth element is research, and we focus a lot on research practitioners. Next, please. So the course overview, our course is a four-year part-time, 20 modules. The clinical training starts in year 2 and 3 in terms of teamwork, and then in year 3 and year 4, the student is expected to work in a setting where they acquire up to 200 hours of independent practice. Personal and professional development happens within the course across the 4 years. On graduation, people are registered with Family Therapy Association of Ireland, which is one of the sections within ICP. Our programme is also accredited by the European Association for Psychotherapy. And the important thing is that once people graduate in the June of the 4th year, they're ready for registration. And once registered, they're ready for their own independent practice. Next, please. So this, I don't have time, but it gives, on a Wednesday, year 1, people learn clinical skills, but they're not working with people. It's a full day a week on a Wednesday, and year 3 is a Thursday from 9:45 until 7 o'clock. Very long days where we do theory in the morning, personal, professional, and then there's a clinical. Each student is part of a clinical team working with families from 2 until 7. In addition, in year 3, people work a half day a week in a separate clinical practice. And in year 4, the focus is on the dissertation. The fees include all therapies, unlike other courses, the personal professional development is contained within the fee structure. Next, please. There's many resources which Barry has alluded to in terms of UCD. We're a very well-resourced university, and we encourage students to avail of all the resources from a great sports centre if people have time in relation to juggling work, family, and quite an intensive 4-year part-time study. Next, please. So we have currently 64 students across the 4 years. We encourage people to think long and hard before they join us, because while there's an exit certificate and an exit diploma at the end of 2 years, within the group, there's a lot of focus on building trust within group. And while there's an academic exit awards, these awards cannot be used for clinical purposes. So we ask people to commit to the 4-year training from the outset. And it's also important, our year 1 is very intensive. So if people do the higher diploma in psychotherapy studies, while it might give them a good overview as to what might be involved in psychotherapy, we require people to start at the beginning of year 1 of our training. Okay, so I think that's it. The key dates are with a rolling application. Our first deadline is the 30th of April, and we will be holding interviews immediately after that. And we have, so we encourage anybody to contact Giselle or myself. And we have open conversations with people throughout the year. And these are some of the team, but we have a great, buoyant and lively faculty. Thank you for attending.